Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action. My name is Nina Sun, and I am an associate editor for the SRHM Journal. Hello, and welcome to another compelling Friday episode of the Sexual and Reproductive Health Matters podcast. In this episode, we explore a groundbreaking study published in the SRHM Journal entitled Impacts of the COVID-19 Pandemic on Access to Sexual and Reproductive Health Services for Women and Gender Diverse People with Disabilities in Canada, a qualitative study. Joining us are Meredith Evans, medical anthropologist and postdoctoral research fellow, and Keat Welsh, peer researcher and disabled artist, activist, and educator, both affiliated with the Department of Health and Society at the University of Toronto, Scarborough. Thanks so much for taking the time to be here with us. Let's dive into the paper. Your research sheds light on a critical yet often overlooked issue: the challenges that women and gender diverse individuals with disabilities face in accessing sexual and reproductive healthcare services during the COVID-19 pandemic. Through interviews with 61 participants between May 2022 and March 2023, you identified four major themes: disruption of care, altered accessibility, social implications, and recommendations for improvement. One of the most striking findings of your study is that racialized women and gender diverse individuals with disabilities experienced even greater challenges in accessing care. You emphasize the necessity of engaging disability communities in shaping SRH services, not just during crises, but as an integral part of healthcare planning. I'd love to ask you some important questions about this paper. Meredith, I'll start with you. Your research highlights the significant barriers that women and gender diverse people with disabilities face in accessing SRH services during the pandemic, issues that often go unaddressed in mainstream policy discussions. Why was it so important to publish this study at this particular moment? What prompted you and your co-authors to bring this perspective forward now?
Thanks for the question. So we knew before doing this research that the COVID-19 pandemic had a negative impact on the sexual and reproductive health and rights of women and gender diverse people worldwide. But we didn't know very much about how the pandemic impacted the sexual and reproductive health and rights of people with disabilities specifically. So it was important to do this research because we knew that people with disabilities already experienced sexual and reproductive health and rights disparities before the pandemic started. We also already knew that the pandemic disproportionately affected the general health and well-being of underserved communities, including people with disabilities. So we knew that the sexual and reproductive health and rights of people with disabilities was likely to be disproportionately affected, and that the pre-existing disparities were likely to be aggravated. So our study is a qualitative study, and we were addressing the question of how the COVID-19 pandemic impacted people with disabilities, sexual and reproductive health and rights. So as you mentioned, we interviewed women and gender diverse people with disabilities in Canada to answer this question, and we analyzed how their access to services was impacted by the pandemic. So foregrounding the perspectives and experiences of underserved communities is really important for promoting health equity. And people with disabilities specifically have been historically overlooked in sexual and reproductive health research and policy. And our research demonstrates that this oversight continued during the COVID-19 pandemic. So our research adds to broader calls to include disability justice and the promotion of sexual and reproductive health and rights, both during and beyond a pandemic. And we'd also like to highlight that the way that we did this research and the way that we published this study is also really important. So our research was community engaged, meaning that we partnered with disability communities and collaborated with peer researchers with lived experience expertise, like my colleague Keat, who's here with us today, in implementing this study. And community collaboration is so valuable for sexual and reproductive health research more broadly, and specifically with disability communities, because it leads to research that is better, that's more relevant, that's more accessible, and that's beneficial for communities. Keat, do you want to jump in and add anything else?
I feel like you covered it, but I would just add that when we're thinking about what prompted us and why, like why now, I think we're in 2025 now, but we started this research earlier in the pandemic, and we know that research takes time. So it feels a little bit like, okay, maybe this was like a bit more relevant 3 or 4 years ago, but we also know that the pandemic is ongoing. People are still getting COVID and long COVID. We know that even though lockdowns are not happening, COVID is a reality for many people and a reality for most disabled people. If you look around the world, the people who are still masking, still taking precautions, are disabled people because we know how it can affect us. We know that putting ourselves at risk for another chronic illness, for another disability when we already have one or multiple, can really impact our life and maybe change our standard of living or change our life expectancy. So even though it might not seem relevant right now, like we are the people who know what the risks of going back to like quote unquote life as usual.
Thanks so much for that insight. I'd love to hear from your co-author as well. As you conducted this research and engaged with participants, what stood out to you the most? Were there any findings that particularly resonated with you or challenged your own perspectives on access to SRH services for women and gender diverse people with disabilities?
I think one of our main findings was that ableism is widespread in healthcare and specifically in sexual and reproductive health. And we kind of knew that anecdotally from talking to other disabled folks. But this research really showed that during the pandemic, things were exacerbated by the risk of COVID-19 and also by the actions of government. So even though our findings are kind of like consistent with what we knew across the board, even without a pandemic going on, it was exacerbated by the pandemic.
So as Keat was saying, that the pandemic essentially made ableism worse, and this impacted health services broadly and disabled people's access to health services. And what we found was specifically their experiences accessing sexual and reproductive health services. So one, I think, representative example is how during the pandemic, especially during kind of periods of lockdown, healthcare facilities were implementing blanket bans on visitors into these spaces. So whether it was a hospital or whether it was a community clinic, the bans meant that only the individual patient was supposed to be entering the facility. And that, I think, is a very clear example of ableism because there's an underlying assumption that the patient accessing the service is able-bodied and could access that service independently. And so we know that many people with disabilities need support people to access services. And these visitor bans made it harder for disabled people to access sexual and reproductive health services. And we found that sometimes these visitor bans ended up preventing people from accessing services altogether. So this was a big issue. And I know maybe Keat, you can speak more to, I know for example, in the province of Ontario, there was disability advocacy groups were challenging the government restrictions around this and advocating for disabled people's right to access services with support persons.
Yeah, I think this highlights such a big issue because when I personally talk to other disabled folks, we talk about like, how do we get the healthcare that we need and we want? And oftentimes getting the healthcare that we deserve really takes someone else being there to advocate with us. And if the government's policy is like, you're not allowed to have anyone with you because of the risk of COVID, like we see how this really detrimentally affected people with disabilities. Luckily, we have a pro bono law group here in Canada called Arch Disability Law, and they did a lot of advocacy around these restrictions that the government imposed. And I think, the other thing that really was exemplified by these restrictions is that the government just was not thinking about disabled people, was not thinking, not only is it someone who's disabled who needs an advocate because we're sick or not feeling well, but, there's also people who are deaf and need a ASL interpreter. There's people who are blind and need a guide. Like, it's not just like, oh, it would be nice to have a family member there. Like, this is kind of like life and death for a lot of people. And the other thing that this paper and the pandemic showed was that with the government not thinking about disabled people during the pandemic, during the lockdowns, during all of these things, we also see the government not thinking about disabled people now with taking away mask mandates, taking away restrictions on certain things. So it was kind of like heavy hand, no one can support you. And then like, now we're going to take the hand totally off. And that kind of pendulum swing is really detrimental for disabled folks.
Absolutely. And one other piece that I'll point to in this article was we heard lots of stories from participants with disabilities about advocating to access accommodations. So fighting with the healthcare providers or the hospital administration to get an exemption to these visitor bans. So from the stories that we heard, it was consistently difficult and created like an added burden on people with disabilities who were seeking care, but that sometimes it became more possible for people who had some kind of privilege. So thinking about how privilege is an intersectional experience. So for example, if participants were white or middle class, cisgendered, straight, had an able-bodied partner who could support them in their advocacy, for example, those kind of factors could make them more likely to access an exemption to the visitor ban. But the stories that we were hearing from Black and Indigenous participants with disabilities, their stories that they were sharing were that they were routinely denied these accommodations. I don't think we heard any stories where an exemption or accommodation was granted for racialized participants. And so this, in our analysis, or this for us, this intersection between ableism and racism was quite stark and is something that really needs to be addressed in sexual and reproductive health and rights.
Thanks both. Your research sheds light on systemic barriers that women and gender diverse people with disabilities face in accessing SRHR services. Keat, how do these findings connect to the broader political landscape and current global events? Are there particular policy shifts, movements, or crises that make this evidence especially relevant now?
Yeah, so kind of like what I was talking about before around COVID restrictions being lifted or there being no mask mandates in place, we do see that COVID is no longer center stage in global politics, even though we know that COVID is the number one cause of disability adjusted life years, meaning premature death and years lived with disability. And the number two cause of death worldwide is COVID. However, we see that the world has decided to move on from it, has decided that there's no need to focus on COVID anymore. But really, I think what, as disabled people, we are seeing is like the government is moving on from it because they don't care about disabled people. And they don't care that we are the ones dying. We are the ones becoming more disabled. We are the ones not being able to work and things like that. So we see that shift. And then that kind of relates to another thing that one of the participants brought up. And we see within Canada, a lot of people speaking about, specifically around people with disabilities and activists around disabilities. And that is MAID, or the medical assistance in dying. So we had one participant say, and I'll quote here, the government has to be interested in letting us live. Then I think they could have a conversation about reproductive health for people with disabilities. The government isn't ready for a conversation about reproductive rights of people with disabilities because they haven't even recognized our right to live. So we see the COVID-19 pandemic and the shift away from that and the shift of like, oh, only disabled people are the ones dying, therefore we don't care about it anymore. And this is a kind of bigger symptom in society where it's like our government and our societies like don't care about disabled people. So medical assistance in dying in Canada, there's two tracks. There's track one, which is if you have a terminal illness, and there's track two, which is basically you can just have any disability and qualify. So the problem is that people are being encouraged to choose assisted suicide or choose medically assisted death instead of getting proper supports from society. So we see healthcare providers are saying, have you thought about MAID? Instead of let's make sure that you have really good housing and really good support networks and really good pain management. Specifically in Ontario, it's quite startling that you can apply for MAID and get approved for MAID faster than you can get approved for disability support. So income from the government around disability if you are not able to work. Yeah, so I feel like these topics around reproductive health and the pandemic are really relevant now because we need to be having these nuanced conversations about what makes a life worth living and what our society wants to focus on in terms of like who matters. And we see that reproductive and sexual health is like not being considered, but like oftentimes our lives aren't even being considered.
Thanks very much to both of you for these insights into barriers faced by disability communities in Canada. At Sexual and Reproductive Health Matters, we are committed to turning knowledge into action. Based on your findings, what do you see as the most urgent next steps? How can policymakers, healthcare providers, and advocacy groups use this evidence to create more accessible and equitable SRH services for women and gender diverse people with disabilities? Meredith, would you like to start?
So, in our study, we were foregrounding our participants' recommendations and what they were saying about how sexual and reproductive health services should be improved for disabled communities. They had various recommendations, and some of those included increasing health and social service funding to improve services, training providers in anti-ableist and disability-affirming care, improving the accessibility of information and communication and facilities, and providing accommodations during a pandemic, like allowing disability support persons in health facilities and accounting for health equity in a pandemic response. But I think for the most urgent next steps for us would be to advise policymakers and healthcare providers specifically to consult and engage with disability advocacy groups and disability communities. So we know that comprehensive engagement with disability communities needs to inform policymaking processes and any future interventions in practice, and all efforts to create more accessible and equitable services in sexual and reproductive health must be in collaboration with disability communities. And I'll hand it over to Keat to elaborate on that.
Yeah, thanks, Meredith. I love these like specific, tangible little things, but I also think that there needs to be a big shift within public health in general. Right now, public health sees disability as a poor health outcome rather than an equity deserving group. So I think we need to expand this idea that disability is just a poor health outcome. And we need to move toward like understanding that disability and experiences of ableism can create poor health outcomes as well, right? Disability is a marginalized group of people, even though we are like the biggest marginalized group of people at like in Canada, like over almost 30% of the population. identifies as disabled, but how are we going to make healthcare better for disabled people as a whole rather than here and there for different diagnoses? Like, we really need to tackle ableism and ableism in healthcare. And I think that really starts with changing the idea that disability is just a poor health outcome.
Thanks so much for joining this discussion and for this meaningful contribution to the SRHM Journal and the SRHR field more broadly. This discussion highlights just how crucial it is to center the voices of people with disabilities in the fight for equitable sexual and reproductive health services. For more details, be sure to check out the show notes, where you'll find a link to the full study as well as information on how to publish with the journal. If you'd like to contribute to this discussion, whether through a commentary, research article, blog, or another format, we'd love to hear from you. As the authors so powerfully emphasize in this paper, now more than ever, we must commit to inclusive, accessible healthcare policies that uphold human rights, social justice, and equality for all. Let's keep that conversation going.